As breakthrough cases of the coronavirus continues to climb, evidence suggests the vaccine isn't nearly as effective as the media and medical establishment had predicted. And One America's Pearson Sharp visited an urgent care clinic in Southern California where doctors say they're seeing a surge in COVID cases among the fully vaccinated.
With a surge in new Delta variant cases around the country, growing evidence suggests the vaccine isn't nearly as effective as the mainstream media and medical establishment insist that it is. One America News visited an urgent care center in Southern California, where doctors say roughly 40% of their new COVID cases are among fully vaccinated patients. One such patient, Brian Conway, was fully vaccinated when he came down with a severe case of the China virus and very nearly died.
So, Brian, you got the vaccine and then you later came down with coronavirus. Tell us about it.
Basically, I got the vaccine in early March, the first shot, and the second shot.
Which variety was it?
From Pfizer.
Pfizer vaccine.
Pfizer vaccine from March 1st and March 22nd or 3rd. I was fully vaccinated. About a month ago, on a Thursday, I got a headache, which is very unusual for me to get a headache. And I just felt absolutely horrible. I got tested and turned up positive. Monday morning, I showed up here with Dr. Tyson.
And how severe were your symptoms when you came in here?
I'm 67 years old. I had never in my life felt that bad.
So you couldn't breathe?
I couldn't breathe at all. I mean, it was very bad. You know, when you lay in bed for 8 days and just absolutely cannot breathe, it was very worrisome.
And so when you came in here and Dr. Tyson prescribed you medicine, how quickly did you recover?
I felt better within 3 days.
So it was a pretty quick turnaround.
Pretty quick, yes.
Do you think that his treatment saved your life?
Absolutely. Absolutely saved my life. Without his treatment, I don't think I would be sitting here.
We spoke with Dr. Brian Tyson, who explained that he's seeing a high number of breakthrough cases just like Conway's, contradicting the CDC's claims that the vaccine is the solution to the pandemic.
So despite cases like Brian's and all the major breakthrough cases that we're seeing, the CDC and other agencies continue to insist that the vaccines are effective and they work. Do you agree with that? What are your thoughts?
If you look at what's going on in Israel, if you look at what's going on in the UK, if you look at even how the CDC had to re-report numbers in Florida and Texas, and even our public health department here, we're seeing a 20 to 40% breakthrough with the vaccines. It's not preventing people from getting sick. It's not preventing the severity of symptoms that we've all been told. Okay, so we all know you can still get coronavirus with this vaccine, and you can still spread coronavirus with this vaccine. I think it's giving people, again, a false sense of security. You know, I'm vaccinated, nothing's going to happen. Even if I get a cold, well, it can't be coronavirus because I got vaccinated. That's the problem.
As a doctor, what have your experiences been with the vaccine so far? How are your patients responding to it?
I've seen a lot of adverse reactions.
More so than you would expect from other vaccines?
Yeah, I mean, definitely. I mean, we give the flu shot and other vaccines, and we take care of a lot of the pediatric offices. We never saw anywhere near the number of cases of adverse effects that we've seen here. I mean, I've seen kids with pericarditis. I've seen one kid with myocarditis. I'm seeing Bell's palsy. We're seeing shingles outbreaks. We're seeing neurologic issues. Lots of rheumatoid issues with achy joints and bones and myalgias.
And you don't think these could be attributed to other things? It seems like it's related to the
No, it seems because there's been a direct relationship.
So the question on everyone's mind, is the vaccine safe?
It does not appear to be as safe as they're telling people. So I wouldn't use the term safe or non-safe. I would say let's look at is it effective, and clearly it's not effective.
What is your thought on the CDC coming out and saying that the vaccine is perfectly safe and they highly recommend it for pregnant people? Not pregnant women, but pregnant people. I mean, are there any long-term studies on the effects this vaccine has on fetuses or on pregnant women?
No. In fact, the study that was shown on pregnant women showed that those who were pregnant and got the vaccine in the first 20 weeks of pregnancy had an 87% chance of miscarriage. Not one healthy child died from coronavirus under the age of 18, but yet we want to subject 4,000 per million Okay, in the state of California, what we got, I think 12 million kids. Well, 12 times 4, that's 48. That's almost 50,000 kids in the state of California that are going to have a problem, a severe problem from the vaccine, according to Pfizer's own data.
Based on the Delta variant and the vaccines and everything that we're seeing, where do you see the country headed in the next few months? Do you think Americans should be worried?
We should be worried in the sense that 18 months into this, we still have no real answers. 18 months into this, we're still doing the same things, expecting different results.
Seems like they're making things up as they go.
We're making public policies not based on science, but control and what I think is best for you. We have an immune system that has stood the test of time of thousands of years. If there's one thing that I would trust my immune system over anything that the government policies are dishing out. And I would also trust the fact that we have drugs that we use that are FDA approved, not emergency use authorization, but FDA approved, that have been shown to be effective and efficient to treat this virus. And I think that that's where we need to go. We need to learn to live with it, we need to learn to treat it, and we need to learn to go about our business and not give in to the fear.
Okay, thanks a lot. I appreciate it a lot.